we're hearing more about the medical research strides of stem cells. People from all walks of life, including former athletes, are seeking out these types of therapies. So, now up to bat for Innovation Stem Cell Center is former Texas Rangers catcher turned Major League scout Dave Roberts, walking out of the GMT dugout after stem cell therapy to his knee. Dave, come on out here and join me and Dr. Bill as we discuss what you had done. Good to see you.
Thanks. Nice to see you.
Thanks for joining us. So before we get to his story, Dr. Bill, tell us about all the science behind stem cells, exactly what they do.
Well, stem cells are really becoming more and more interesting and being more and more part of the conversation in medicine. And one of the reasons is anything that heals in the body is really related to stem cells. We can use a simple example of cutting your finger. When you cut your finger, the damaged cells release certain chemical messengers called growth factors. And those growth factors call in all the things we need to clean up the damaged cells, and then stem cells come in and lay down the new skin cells to heal the wound. So same basic process happens when you break a bone, when you do just about any healing. It's stem cells that produce the new cells that do the healing.
And it really is incredible what can be done. So we mentioned that Dave came to you with some knee issues. What exactly was he needing?
Well, Dave had some knee problems from back in his days playing, and you know, he's real active in his scouting job, and off season he likes to hunt and fish and do those kind of things. So he was having quite a bit of discomfort that was limiting what he could do. So he came in to see what he could have done rather than having surgery.
Yeah, so it sounds like you're a very active guy, even post-Rangers. What was life like for you when you were suffering with these injuries with your knee?
You know, the last couple of years, pain every step. Not major pain, but enough that it bothered me. Not quite limping, but painful. And I certainly couldn't get up and down the mountains like I like to. And I always go hunting each year, and I couldn't. I'm not just walking around on flat ground.
Right.
I'm doing something and going somewhere. So there was pain, a lot of pain, especially walking downhill. A lot of pain.
Okay, interesting. I want our viewers to take a look at some video we have of Dr. Bill administering the therapy that was done to your knee. I got to ask you, what were the treatments like?
They were painless. They're very, very easy for me to. Everything went. It was easy. No pain.
No pain?
Of. No.
And did you notice a difference almost right away?
Immediately.
Wow.
Like almost when I walked out, I felt better.
So Dr. Bills, we're watching this. What do we know about stem cells? Are they actually doing? What are they doing to help the knee and other joints?
Well, that's really one of the reasons we're doing research. We can't answer that question the way we'd like. Everybody asks us the same question, are you going to build me new cartilage?
Right.
And right now, we've got good early evidence that we do that, but we certainly can't say that for any certainty. What we are getting good evidence about is that we're really good at diminishing pain. And ultimately, that's one of the major goals. If I can get you walking without pain and functioning well, then it's not as important how much cartilage we have.
Let's talk about some of the other disorders that you're using to treat and help people with these stem cells.
Well, we're doing not just knees, but most of the other joints in the body. We're doing inflammatory arthritis, like rheumatoid arthritis, lupus, and diseases like Crohn's disease. We're doing a lot of lung patients with COPD.
Wow.
We're doing some neurologic patients with neuropathy and diseases like Parkinson's and even spinal cord injuries.
Well, Dave, you look like you feel better today. How are things going for you?
Good. You know, the first 6 weeks, I would say I felt great. The last 3 or 4 months, just a little bit off from what I was, but in the last month or so, starting to really feel good again.
That's great.
I think I'm on a kind of a normal pace to continue to get better.
Life-changing.
So,
well,
yeah.
good to see you. Thanks so much, and good to
Thank
see
you
as always, Dr. Bill. All right, you can find out more about stem cell therapy and disorders being researched at InnovationStemCellCenter.com, or simply call the number on your screen. It's 214-669-6948. And GMT is back right after a short break.